My dear friends and my dear subscriber, once again I welcome all of you to my channel Dr. R.S. Surgeon Vlog. Now this video I am bringing in English so that it can reach a large number of population. And in this video I am going to talk about a much wanted drug nowadays, hydroxychloroquine. Now you all of you that we are all are running through a very bad phase and we are facing the attack of corona or COVID-19 virus. Now this is a emergency situation in whole of the world as a large number of casualties are there because of this disease. And at present situation, we are not able to find any particular solution to it. So many countries are trying to come out with some vaccine that can prevent this disease to large number of population, but still this manufacturing of these vaccines are under trial. So the best way to come out of this situation is an isolation and lockdown, which a large number of countries are now under a lockdown, and we all are having a lockdown period. Yeah, we are medical professionals, so we have to go and attend the cases in our hospitals. This is our duty of what we are doing. And once again, I will request all of you to please stay at home and help us to serve you people better way, and so that we can avoid a large number of casualty. Now, why this drug hydroxychloroquine is in much demand in whole of the world? This drug is hydroxychloroquine. Now, this particular drug, it's not that the name of this drug has come out first time. This drug we are using since ages and ages, and the main use of this drug was to treat the patient who was suffering from the malaria, or the patient had been given prophylactically who are needed to get exposed to the area where the malaria is there. Beside malaria, it is very commonly used for the rheumatic arthritis, and so many other diseases, so many autoimmune diseases are there where this drug is being used. But now, when it's found that this drug is able to stop the growth and replication of COVID-19 virus, now this drug is in high demand. Now, we all know that COVID-19 has got a intensive power to replicate and spread from person to person. Now, this drug had been found that it can stop the replication of the virus and can prevent the disease or help in the early recovery of the patient. Now, so many questions are there in the mind of the people whether we all should use this drug. No. Only the person who are taking care of the COVID-19 patient, or when we are treating the patient who had already suffered from COVID-19 disease, we are using this drug. You know that COVID-19, what exactly it causes in the body? Now, it causes severe acute respiratory syndrome. Mainly this virus is affecting, first it affects the upper respiratory tract, that is nose, oropharynx and throat, and it stays there for few days. Then it replicates and reaches our lung. In the lung, it causes very severe type of pneumonia, and soon the person finds difficulty in breathing. And those who have a lesser immunity, these people are very much affected by this drug, and that's why it's causing a large number of mortalities. Now, what this hydroxychloroquine drug exactly does, it breaks the chain of the COVID-19 and it breaks the replication of it. You know, COVID-19 virus is bonded by a lipid, a fatty layer outside, and it's very difficult to break it. Now, these drugs had been found to be working in the case of corona or COVID-19 disease, and it helps in stopping or spread of the disease. Now, this is not, once again, this is not for the general population. It is only for the healthcare professionals or the person who are going for the screening, or who are going to various areas where there is suspicion of the corona patient. These persons should take hydroxychloroquine drug, and this is being used for the patient who has already suffered from this disease. Now, this drug can be used alone or along with the antibiotic, that is azithromycin, it's given, or along with the antiviral drugs. So many antiviral drugs are there that is being used to treat this disease. Now, how this hydroxychloroquine is used for the healthcare professionals who are treating the disease and who can be exposed to such person anytime. Now, this drug has to be taken in the dose of 400 milligram twice a day, 400 milligram twice a day, and thereafter 400 milligram once in a week for at least 7 weeks. So the dose is again 400 milligram you take in the morning, but this drug should not be taken empty stomach, and better to take any antacid along with it. You know, we come across so many complications that this drug can cause, that can include a severe complication like QT wave prolongation leading to the heart attack. Then G6PD deficiency it can cause. It can cause various blood disorders. It can cause a retinopathy. Your vision can be hampered. Besides that, nausea, vomiting, pain, abdomen. So many, the long list of complications are there that can happen because of this drug. So I will advise all of you not to take this drug without the prescription of the doctor. And at present, this is not for a general public who are put themselves under the lockdown or who have been isolated. It's not for them. For them, it's just a hand wash, using a mask, using hand sanitizer. This is enough. But the people who are already supposed to be exposed to this disease, this type of person, or the patient who had already suffered from this drug, this disease, we are using this drug, hydroxychloroquine. You have come across the news that the various countries have put their demand on our country, India, to give them the supply of hydroxychloroquine, and it is really very highly appreciable, and it is really a very proud moment for us Indians that we are in a state where we can help other countries, because nothing is greater than the humanity. We know at present condition, our country is lying somewhere in the stage 2. It has not gone to the community spread stage 3. So we have got some time to manufacture this drug. If this drug is needed for our population, we have got some time, and Indian industries, pharmaceutical industries are working at a war pace to manufacture this drug, so that they can help other countries and they can help our people if needed. So at present, there is not much demand of this drug in our country, so we have got ample time, and we are working at a war pace to manufacture this drug, so that the large quantity of this drug can be manufactured, so that we can help other countries, and we can help the people of our country. So this hydroxychloroquine, basically this drug derived from quinine, that is derived from a bark of the cinchona tree. So it has got certain chemical formula, and raw material in India we have got in ample quantity, and we can manufacture crores and crores of these tablets in our country, and we can be of use of so many people. So through this video, I would just like to tell you that please don't just go to the medical store and take this drug starting, because it's got a lot of large number of complications that you should be aware of. Please don't take this medicine without the prescription of the doctor. If your doctor feel like, he will do certain tests like ECG, your fundoscopic examination, and other tests he will do, and then only he will prescribe you this drug. So be careful while using this drug, and I hope that whole of the world will soon get out of this COVID-19 disease, and we will be having the same happy life as we used to have earlier. And I once again request all of you to please help us, all the medical professionals, so that we can help you better. Thank you very much for watching my video, and keep watching my channel, Dr. R. Surgeon Blog. Thanks a lot.